going to be introducing you to and telling you about. It will probably come in useful.
So the handout that Mr. Armstrong's giving you is just a general handout about that.
That's right.
If you brought your MedSurg book, Iggy, today, this would be a good time to get it out. Okay, that's what I thought. If you didn't, you can share the ones, oh good. If you didn't, you can share the ones that we brought from our offices. 2 people to a book. Because I'm giving you a crossword puzzle. Take one and pass it down.
Yes, so take one and just pass it right on around.
So you have
the
your
table.
They have one. Pass it down. All right. So today's lab goes with the introduction to the oncology information we just did. And in 2 weeks, because next week's Thursday, we're going to talk more about cancers, and we're going to talk more about competency 10, and we will talk in detail about breast cancer. So today's lab goes with that, and what we want you to do over the next 35 minutes or so is fill out the crossword puzzle. And it is from the chapter in Iggy on breast cancer. So this also then can introduce you to that chapter and the reading in Iggy.
2 to a group, right?
2, yeah. Try to share. Now there might be some more in the. Ken, you want to check the closet?
I don't think we're sharing these.
If there's one, I don't know that there is.
Any more?
In the did anybody else bring their book? I see one. So you guys can share your book.
So there's one here that can be shared.
It doesn't matter whether it's the 5th edition, the 6th edition, or the 7th edition.
Okay, so how many people are still missing a book?
Access to a book. There's one.
There's one book here. Okay, so there's those pair,
the
that
book
pair.
is nice, but I'll tell you what. You can also look it up on your tablets, your cell phones, or other things.
Yeah.
Plug it in, use your electronic devices. The book is better because actually the crossword puzzle.
I think we actually have enough. I think we're okay.
The crossword puzzle was actually written from the 5th edition of the book.
73.
The 6th
Yeah, see,
edition
right
and
over
the
here for you,
7th
sir.
edition still have pretty much the same thing.
Now, if you noticed also on your checkoff list for your skills for this semester, one of them says breast exam. So what we will be doing today is that as you finish this class, you will get credit for having done the breast checkoff, because we will be going around and showing you with the breast mannequin proper procedure, okay,
For breast exam.
for breast exams. And so we'll be talking about it. Plus, on the back of the crossword puzzle,
Turn
you
over your
will
crossword.
see the drawing of a torso, okay? And you will identify on that area, whenever you do the exam on the model, you will identify the areas of abnormalities that you find, and you'll make note of them on this schematic.
There are 2 techniques of physical exam that you're going to use with this model.
Let me move this.
One is observation, and the other is palpation. So you're not going to auscultate with your stethoscope or anything. We're not doing your lungs. This is a breast exam. Now, this model has been mutilated
It's very old.
because somebody with fingernails
It's pushing.
pushed under the axillary area to find the axillary nodes, which are positive, but you're not going to be able to touch it because it's been damaged. This is a really good breast model. The problem is we can't seem to find more like this. This one's from Japan.
In Korea, we can't determine. It's all written in Korean on the box.
I think it's, well, whatever. Anyway, it might be Korean. So it's in kanji. So the breast model has things that you will draw that you see or feel. And I'm going to come around, we'll come around as you're working on the crossword puzzle, and like 4 of you can do, or 3 or 4 of you can do the breast exam and write it on your paper. Okay? At the end, we'll go over the crossword puzzle, we'll give you the answers to the breast model, the breast exam. We decided not to actually stamp your lab check sheet for this. There's no need to, because you're all going to pass after you do it today. Okay? We want you to take it seriously. You know, as Mr. Armstrong says, this is not Saturday night in the back of the car. You're going to do a professional breast exam, right? Well, people get silly, and that's not really a good idea, because you're going to be nurses. we'll talk, you need to do your own breast exams too. And can men get breast cancer?
Yes.
1% or 1,000 a year, males get breast cancer. We had a couple men, a couple semesters ago at Anne Arundel Oncology Unit. One was an elderly African-American man, I think he was like a high school principal, retired, and one was an elderly Caucasian guy.
Oh, yeah.
And they had breast cancer, and it was being treated the same way with the same drugs as a woman would be. So if the take-home message there is if a man notices a lump growing under the nipple, he should have it checked out. Because it's rare, but it's possible. Okay? So go ahead and start your crossword puzzles. I also have, at some point here, probably right after we go over the crossword puzzle and after everybody's done the exam, I have I'm going to show you the first part of a video. Okay? A medical video, but it's still good.
So for general understanding with this, what we're going to be looking for
Draw
is
anything you see or score.
you will find where there is a discussion of a wedge,
techniques.
a vertical strip, or the concentric circles.
Concentric circle.
Concentric circle. So, but either one of these processes, we recommend the pads of the fingers, okay, on the second and third fingers. So you're going to be pressing in on the tissue this way, okay? Everybody looking at me?
He's trying to give you some hints about the correct technique for breast exam.
So these are really the only two fingers that, with a proper self-exam, that you should be, you use these two or these two here, okay?
Gently.
Gently. That's kind of be where you're going to be going, right? Okay. So that's going to kind of be the proper way. You can start depending upon which method you'd like to use, okay? But once you come all the way out of the breast area, remember the breast tissue does not stop here, just at the base. It comes all the way up to the clavicle and to the neck and all the way under the arm, okay? All the way up underneath the arm, okay? So that's just what we're going to be looking at, okay?
As I said, you can't do the axillary node palpation.
Correct.
But
Right.
you can do the infra and supraclavicular node palpation
Right.
on the model.
That's exactly right. So this is teaching a life-sustaining thing to a woman, right? Because this can mean the difference between life and death for them. By doing this consistently and doing it appropriately, they can find something early so that it can be treated, and it can be a difference between life and death. So it's very, very important as we in the medical profession make sure that we are aware of what is technique and what is the proper way to do things and how to educate the patient, right? But you got to know how to do it first yourself.
Right.
So
you can
this
do
is
your
what all
own
this is
breast
going to
selfie.
be about, okay?
And then-
All righty.
All right. Do you want to start coming around and I'll just get this ready?
Oh, I don't care.
Okay. Here's this. Have you seen these things in the bathroom? They used to have them in the bathroom here at the college. This is American Cancer Society, how to do the breast self-exam. So I can pass that around, you can look at it. Have you seen the shower cards? American Cancer Society has shower cards. This one broke, but it goes over the shower. And this one's from Howard University Cancer Center. And it talks about the steps for breast self-exam. And the reason it hangs in your shower is because what? Because a good way to time to do your breast self-exam is when you're sudsing up or putting on, or cleaning yourself in the shower. The one that ACS has, American Cancer Society, has a woman doing breast self-exam on one side, and it has a male doing testicular self-exam on the other side. Because young men should also be doing testicular self-exam in case they find an early stage small testicular cancer. This one is just for breast cancer. Okay? Okay, so the book is helpful because, as I said, we wrote the crossword puzzle from that chapter in the book. It gets you acquainted with this chapter in the book, which is part of your readings for this competency anyway. So share the book, work together on the crossword puzzle, it's not a secret, and we'll start coming around with the model. Then you can turn your crossword puzzle over and write what you feel and see. Please make sure your hands are clean. Please be very gentle. Please don't poke it with a long fingernail.
Make sure you don't have a pencil or a pen in your hand
No pen or
when you're
pencil.
trying to do this.
Yeah,
Because-
sometimes you forget it's in your hand. Put it down.
Right. Okay.
All right, you guys ready to do this?
What's together is not a secret.
I'll start.
Yeah.
Yeah.
Okay.
Yes, thank you.
This long one. Okay. We don't have it yet.
Typical
All right, you guys can go
presentation of
first.
benign breast
Here's
disorders.
Betsy.
Because it says it's a three-word, so the
Best
only
thing to
way
do is
that
probably
has a
just put her on the
three-word.
table.
That might be too fine.
So we're just marking
Flip.
down.
What you see and what
Benign.
you palpate.
Okay,
So you're gonna palpate both breasts.
The
I
box.
advise you to go here also, and then what you see.
No, for the box.
So just draw what abnormalities you see and feel. See and feel. Go ahead, palpate. See, it's the people do it right over here.
No, I know, but
The nipple. It's just supposed to be.
Can you tell me the
And then, oh, good, and also label it.
It's
Yep.
1672, that's why we're at chapter 73.
It is supposed to be little petechiae. It's really hard to do, but it is actually.
So
on
is
the
it
answer.
saying, this says number 4,
Okay, so this is
benign
where we're working on
breast disease.
the model.
What is the name?
Benign
Chronic AE,
breast
that's one of them.
disease is fibrocystic breast condition. I hope so.
It doesn't fit, I don't know.
It doesn't fit, the condition doesn't fit in. As you said, it's a 3-word.
I'm doing the other numbers.
Is it not the infiltrating ductal carcinoma?
Who did it fit?
Let me count it. 1, 2,
Yeah,
3, 4, 5, 6,
I think it's not.
That is invasive
I
breast
corrected
cancer.
Ken,
It's
even
not
though
cancer.
I don't like to do
It's a
that 'cause he was-
benign.
the word
breast
concentric
disorder.
circles is actually
You're
important.
looking at it under cancer.
Concentric means like here and around concentric circles. For your crossword puzzle,
But you guys are done with that, guys, let me know, I'll flip it.
Maybe that's the one.
This is the one. This is 1, 2, 3,
Just, I mean,
4, 5,
it's-
6,
No, it's
7,
not.
8, 9, 10, 11.
Which part are you doing? Have you been able to
Anything.
do BSc?
You check it.
Expression of the breast tissue projects and lateral disturbance.
You see, what is one
Yeah,
now?
flip.
Three now. And this one.
turn her around, yeah. That's a good idea. Okay, Miss Betsy, turn your head to the other part of the bed. Put your head at the foot of the bed.
The pew door hinge. Yeah, please go down.
Yep. Yep. I'll show you the answer key once you're finished. Yeah, the typical intraductal or lobular carcinoma of the breast, the most common ones, are a hard mass. After a while, she starts to dimple and you can see where they are. And the ones, there's 3 and they're pretty obvious.
And there's supposed to be one down here, is that why there's like a,
No, there's not one down there. You do see the skin changes. I mean, palpate for yourself, see if you think there's one down there.
Did you just, I thought I felt one down there, it could have been the dummy.
Oh, you mean this?
No.
Oh, that's probably, don't go down there. Stay away from the axilla. Just stay on the breast. I think it's the ridge up on the model. I don't think it's actually.
And this too, this is all red.
I think that's part of the model.
Today.
Think of it as a
Look,
10.
does it get all what they ask us?
Correct.
It's supposed to be the same thing. Now, where did you get the 7?
Hmm?
The 7.
Invasive breast cancer. The PPU, the
This
orange,
one only has
orange
one?
peel skin.
Yeah, it's all bumpy.
Orange peel. This one?
Yeah, the orange.
That's number.
They're using a word called eczematic, like eczema. says axomatic change of the nipple is pathognomonic of Paget's cancer, which is inflammatory. So that, if you look at number 7, that's the one. That's this little thing.
They don't breast exam in here.
Really?
It's
in the
a
chapter.
self-exam for 1594.
Yeah, it's okay. So they're referring to it at these little bumps on here as eczema. Don't worry about that.
So we got the same. Just take that one away. That was oops.
These are the ones.
Erased.
Hmm?
2 here, 1 here, 1 nipple, 4 field, discharge, and spirit. Here. Alright.
Are you finished with her? Okay. Next team. Here's the answers. You can share. All right, everybody. Here comes Betsy. So turn over your crossword puzzle because it's your turn. You can stand up. They're all trying to turn her around so they don't have to move. Because you're usually standing when you do a breast exam anyway.
There was the one over here.
Okay.
And then turn over your crossword puzzle and draw and feel the abnormalities. Stay away from the axillary nodes.
It's marked on here though.
I know.
Oh, okay.
But yeah, this is
Mom, what if we go with it?
Right here.
you won't feel it anyway because
Oh, yeah.
there's holes written in them
Oh, yeah.
from overzealous exams. Yeah, you can look at the answers. Kind of cool.
Wait, what page is it? You wanna look at that?
So we decided there's really no way to check you off on breast exam. We're just going to pass everybody.
Breasts are located between the second and the what rib?
Okay.
Did you all see this?
How many ribs do you have?
Do you get all of them?
This normal.
Yeah. So you gotta consider, like, your fifth is like here. So you gotta have them.
No, wait, it's the breast we check, it's not the breast.
Oh yeah, but you know the link, the breast and the breast tissues, all of them comes up to the side and towards the hand. So that's what I'm saying. If it's this one normal.
One hand. You have to examine with 2 fingers on one hand.
Did you find number 5?
Gently.
Okay, I got it.
I think it's 3. Yes. This one
This
gets
is 2.
This I just saw.
There's a French one and an English one.
it's 2 on the left breast.
Yeah, and the nipple.
The nipple too.
The nipple, the nipple is having discharge. Is
Yeah.
that so?
Okay.
Discharge.
Will have discharge as well.
You done? Yes.
First one. Yeah.
Which number is that?
It's the part of the nipple. Here, the
Right
breast,
side or the left
the
side?
nipple.
It's the right.
Okay, for the breast.
Let me see this number.
This is
Five. This what?
question.
No, because your fifth is like here. I think it's 9. I mean, your breast goes all the way down here. Wasn't it?
I need to look.
It could be 6 too. That's yeah, find out what 1 down is. The suspensory ligaments support breast tissue and become contracted in cancer.
You're supposed to give the exact number of breasts.
N E C O. Where did you see number 6?
Yep.
The following presentation is brought to you by Discovery Education, leading the world of digital and remote learning. Discovery Education, connect to a world of learning.
Cooper's ligament. Cooper's, ERS, then ligament. Ligament.
I just saw that word too. The French word.
Yeah? Yeah, the French word is the one that goes
It's
in.
something like orange peel. The orange peel. I don't know.
Just like dimpling. Right, and this one has discharge. Red discharge.
You studied 5 years of French in high school, you see.
This one, which one is this?
Yeah.
Which one? Yes.
This stimulates breast development.
It's PSA.
What is this? Fiber.
PS.
Yeah, PS.
We're done with it.
Okay, pass her along. Okay, you guys, go ahead.
EEN. So like,
Press this out, Kate, and look, and then draw it on your picture. There's what this is. No, not yet. Okay.
Is this one F?
Huh?
Is this F? PSF or PS?
PEAU.
No, I got PH.
5.
Orange. It's number 5 that I'm looking for.
5 down.
Estrogen.
You guys gonna finish with the model? You wanna see that? Everybody's gonna pass. Some people missed number 5. And don't worry about the nodes, the Exler nodes, because you couldn't do that.
Number 4.
Number 1 down.
Yeah, this picture's a little misleading. It looks like the color. It's really the texture of the skin. It's the texture, not the color. It looks like it's
People discharge and is kinetics changes.
That feels like 9 and then an F. That's 6.
Yeah, test 4 is competency 10 and 11. The breast information about this, yes, because it relates to breast cancer, which is this chapter.
Are you using it?
How do you spell that? Gynecomasti.
Yeah, only one of
What do you look for? Either concentric circles, wedge, down, systematic, so you're covering all the breasts. You find
No,
everything?
no.
Yes. That long one. What's one down? I don't even know which one is the breast.
You know, you put your picture. Method of breast palpation.
Do we label it?
Yeah, I want to
Looks like I'm kind of.
Do we have to?
I mean, obviously, number 4 you couldn't do, but did y'all get number 5?
see this one is
I got it.
if you see
I don't mean on the crossword.
Oh.
I didn't want to say what it is.
yeah, I think I have this one.
Method of breast palpation.
I don't want to give away the answer.
Talk about palpation.
You want to watch?
But you might as well get a chance to see this once you've done it.
But let's continue with the puzzle and come back to this.
This takes 2. Because that's
Yeah.
I'm not going to move that down until they're finished, until people are finished. No, not yet.
Oh, okay.
Have to finish first.
Oh, okay.
You don't get the answers till after you're done.
Okay, next time.
Could I have a signing sheet?
Unless
You see why it is difficult for
maybe the second and this is
You got it well. You sure? Look it up.
I did.
All right, next.
I want
group.
to let me see your puzzle.
I'm not sure.
Yeah, this is T.
I got a one here. This side.
It's still here.
Yeah, let's see.
Most common relation.
Okay, what are you doing? You know,
You finish?
not everything.
Yes.
The answers to one of the questions.
This is fibro.
Fibros, cystic,
Number one down.
disease.
This is what they are.
Oh, yeah.
What is this thing here? Is
Those
wait,
ligaments
I'm even
sag
missing
as you
it.
get older.
Let me write it. I'm missing it. Let me complete it, then I'll give it to you.
What?
Young
What's
people
the
have nice,
question?
nice,
Denying
young women
breast?
have nice tight fibers, stretched out ones.
No. This one we put E, T, E,
Denying
N,
breast
T, X,
Take your time. Yep.
I, X.
There's still plenty of time, so if you're palpating, take your time, share.
No. I think
Wrong with
it's
you.
number 8 be 10 or something like that.
is method of breast
You see what I
palpation.
did?
No.
See here.
Number 8. It's a method of breast palpation. 2 words.
Yeah, like in
This is
automatic.
sixth.
Number 8. Yeah, this is 9.
Number 8?
Method
Yeah.
of breast palpation.
This one should work.
Okay, so you got it corrected.
It's not real obvious, is it? That one, because there's a couple different methods.
How do you spell the French word?
Martha, you say you saw number 8.
N right there. Me?
No, I said it. They said it's 2
Words.
words.
It's not self-exam.
So which one did you
Self-exam.
people even do?
Interpretation.
Which one did you people do?
Which one? This one.
I don't have any.
12 to 1:30.
No, this one we did this one.
Same as every other week. We
7?
probably won't go that long.
What's it then? Sure.
It's 7, not 6.
I don't know. I just guessed this.
Everybody see and draw what they,
Pass the ligament.
What level is it?
bring her down
Where is
here a
it?
little more.
One down. One down.
For what?
What is it?
No, wait. That's one down.
Yeah, you go ahead. You can
One
share.
is
Like
Down,
second, third.
Oh, the page. Okay.
Second. I don't know.
COPERS.
Where is that?
Here on page in this book 1663.
Let me see the
Finger pressure.
Finished, you can look at the rest of the chapter. See what it is.
I'm on the same page as
This
that.
A.
This is
I found it, but I don't know where it's not even this. The third letter has to be an S.
It is, C-O-N.
Oh,
It's one down. This
C-O-N
suspensory ligament supports breast tissue and become
C-R-I-C-C-I-O-C-L.
contracted in cancer. What is it? Please
thank
undo.
you.
Concentric. It's a weird name. That one's not
I
real.
have the same page.
This is the page. Where on the page?
Alright, so now we just have
And
those.
this-
This portion of breast tissue projects up and
On
down.
this area.
CONCENTRIC and then circles.
Yeah. Yes.
So this portion of breast tissue projects up and laterally.
Concentric circle.
Done.
You're doing a good job with the
C.
model. Although when you see the answer sheet, you